but it really sort of relies on a sequence of 3 drugs that have to be given in the right doses and in the right order. The first medication is a medication called sodium thiopental. You don't need to remember the name, but basically it's the same medication they use in hospitals that typically put someone into a sort of medically induced coma. You can see it going into the body there, Virginia. First thing it really seems to affect is the brain more than anything else. Sort of shuts the brain down, takes away the senses. To your question, that's why he doesn't really feel anything, but it really sort of starts to put the whole body to sleep, including the heart. Your breathing slows down. He really is kind of asleep, unaware of everything. The next medication is very critical. It's called pancuronium bromide. Remember, this is a paralytic medication. Very critical to be given as a second medication. This is also given through an IV, so an IV has to be placed. And then this medication is a paralytic. It paralyzes all the muscles, Virginia, including the diaphragm. And that's critical because the diaphragm is what you use to breathe. So he essentially won't be able to breathe on his own anymore after this medication is given. But look, the heart is still beating with this particular medication. Finally, the last medication is something known as potassium chloride. We've all heard of potassium. But one thing that many people may not know is in really high doses, when it's given again through the IV, is that it causes an abnormal reaction in the heart. The heart simply can't conduct electricity the way it normally does. Take a look there. The heart starts to quiver, and that's probably what leads to the death, ultimately. The heart simply can't anymore. And that whole process that I just described takes just a few minutes, usually less than 5 minutes.
Wow. What if there are any mistakes made while delivering these drugs? Would the person feel that?
Well, that's a really good question, and there's a couple things that can happen. One is that you may not be able to get an IV in, and this happened recently. This is all sort of dependent on the fact that you can get a good IV in that can administer these medications. But if you give the incorrect dosing of the medications, or you give the medications out of order, you can feel something. So, for example, imagine someone being paralyzed who's still wide awake. Just imagine that feeling. You can see the same thing here. You see the animation, but the person's muscles start to tense up. They simply can't move on their own, and they stop breathing, but they're wide awake, or at least awake enough to recognize what's happening. That can be the type of mistake that could possibly happen. But usually the doses of the medications are all sort of prepared ahead of time, just to avoid this type of thing. One thing I found interesting, which I didn't know, is that doctors, other healthcare professionals, are typically not present at the execution.
Really?
No anesthesiologist. This is being done by a specified team. So there's no one to sort of oversee all this medically. It's all predetermined. All the doses are preset. All of that ahead of time. So that's typically what happens.
So is it prison personnel then that are delivering
Yeah,
these
I guess
doses?
there's a specific staff that handles this type of thing specifically. They are trained to put in the IV. They can do that sort of thing, but not they don't have a medical background, so to speak.
Right. That is actually surprising that you wouldn't have anyone there to oversee in case there needs to be some last-minute
adjustments.
Exactly.
Yeah, I think that they do examine the patient ahead of time, determine body weight, and as a result figuring out the right dosing and all that sort of thing. But yeah, again, I was a little bit surprised by that as well. I just learned that.
Now, obviously, we've heard a lot about death by lethal injection. It's been going on for a while now. Is it considered the most effective way and the most humane way to do this?
I think humane, for sure. There are a lot of effective ways to actually carry out an execution, the ones that have been also tried and true over the years. But as far as humane goes, if you can find an IV and you give this medication, the pentothal, the sleeping medication, so to speak, first, the person really has no awareness of anything after that point, and we're talking just the first couple of minutes. So the second 2 medications of the 3, the person really never even knows that they went in or experiences any of that.
And typically total time then to end a person's life using this method?
It should be somewhere around 5 minutes or less. So, there have been cases, which I think you're alluding to, that have taken longer, either because of the inappropriate or ineffective placement of an IV or not the correct dosing. So those things can go wrong. But if everything goes sort of as planned, you're talking about less than 5 minutes.
All right.
It's a morbid thing to talk about.
It is. It's a difficult subject, and yet because it is something that is carried out in this country, it's probably something that people wonder about or maybe have a right to know about how this works. Sanjay Gupta, always a pleasure.
Thanks
Thank
for
you so
doing it.
much.
Yeah, appreciate it. Thank you.